Hey everyone, it's Cole and welcome back to Cole's Pain Relief Reviews. Today we're going to be reviewing acetaminophen and paracetamol, which are actually the same thing. I actually didn't know that before doing some research. Acetaminophen is the United States Adopted Name System, USAN, for medications, for generic medication. Paracetamol is the international non-proprietary name, which is another system, international, for the same medication. Usually these names are the same, but acetaminophen is an unusual exception. Some brand names for acetaminophen are Tylenol, Panadol, Calpol, Alvedon. Acetaminophen is also found in combination drugs including Excedrin, Dayquil, Nyquil for generics, and prescription drugs like Percocet, Furoset, Butalbital, Vicodin, and more. Medications containing acetaminophen in combination sometimes have the label APAP added to them, such as hydrocodone APAP. Always remember to only take prescribed doses of the same medication, even if they are different brands or combination sources. Always check the label for the generic name of the medication when taking unfamiliar over-the-counter or prescription medications. Now that we got the naming convention out of the way, let's get to the uses. Acetaminophen is a painkiller that works on most pain sources, including headaches, muscle pain, joint pain, and injury. It is the quintessential standard medication one thinks of when we think of over-the-counter pain relief. Acetaminophen is also an antipyretic, meaning that it can be used to reduce the temperature of a fever. Now that we've finished talking about the uses, let's discuss dosages. An adult can take 1,000 milligrams or 1 gram in a sitting and 4,000 milligrams or 4 grams per day. The maximum dosage an adult could take of 500 milligram tablets is 8 per day, 2 tablets every 6 hours. This is the absolute maximum and is generally not recommended. Overdose symptoms are generally GI distress, dysfunction, pain, sweating, confusion, and weakness early on. Later and more serious symptoms are jaundice, which is the yellowing of the skin and eyes due to liver dysfunction, pain in upper stomach, and dark urine. Drinking alcohol with acetaminophen is not recommended because it increases the risk for liver damage. Now that we've talked about dosage, it's time to talk about how the medication works. The entirety of the mechanisms in which acetaminophen relieve pain are not fully known. Acetaminophen primarily works through the blocking of chemical signals called prostaglandins. It is thought to secondarily act upon cannabinoid and opioid receptors. These secondary mechanisms are less understood. Some of the pros of acetaminophen are that it's effective, it's affordable, and easy to access whenever. You can get it from literally pretty much anywhere. It's safe at higher doses than NSAIDs, such as ibuprofen, and it can be combined with NSAIDs if needed. The main cons are that it does liver damage due to the buildup of toxic metabolites and the effects on prostaglandin synthesis. The liver damaging effects make it less tolerable in the long-term use than NSAIDs like ibuprofen, despite having a higher tolerable dose per day. Again, you should never combine acetaminophen with alcohol, as it will increase the damage caused on the liver. So generally, you could take ibuprofen. Ibuprofen is more dangerous in the short term. It has a smaller dose that you can take in total, but over a long period of time, taking Tylenol or acetaminophen will cause more damage in the long term, chronically. The other issue is more systemic with prostaglandin inhibition. Acetaminophen is considered a weak prostaglandin inhibitor, but the fact that it can be frequently combined with NSAIDs like ibuprofen means that the effects of prostaglandin inhibition can be stacked. So what's the problem with prostaglandins being blocked? Aren't they pain signals? Well, prostaglandins do signal for pain, but unfortunately they also signal for many other necessary processes. Some functions of prostaglandins include signaling for clot formation, the constriction of veins, the dilation of veins, the constriction of the airway and dilation of the airway, decrease in eye pressure, contract or relax smooth muscle in the GI tract, and hormone regulation. Now, inhibiting these signals could cause a variety of issues over time, which is something to keep in mind if you use acetaminophen or NSAIDs on a daily basis. That's why even though the maximum is 4 grams, I try to avoid taking the maximum whenever I can and skipping doses because it does block for pain, but it blocks other things, and it's good to try to cut down as medication you take if for pain over the counter if you can. So my experience in review is I personally take 2 milligrams or 2 grams, so 2 pills in the morning and 2 at night. It helps to take the edge off in the morning, and I definitely benefit from the relief. I just wish it was safer for long-term chronic use. I'd rate it a 6 out of 10. And so now that we've learned a little bit about it, we can consider if it's a good fit for us and ask our doctor if it fits into our lives. In the description, there's some of the sources I used for the video, so you can click those. And there's also a link that I'll put to help you find it on Amazon. I hope you have an awesome and pain-free day.